Hello, good afternoon. My name is Brandon Cloud, and thank you for coming by to speak with me today. It appears that you came in because you need to stop drinking and that it's ruining your life. You report drinking a bottle of wine nightly for the past 5 years, and you've missed multiple days of work and recently received a DUI. You've attempted to quit cold turkey but experienced tremors, nausea, and anxiety. You deny any seizures or hallucinations, and you report using alcohol to relax after work. Yeah, so CM, thankfully there are a bunch of options available for you to help you with your cessation of drinking alcohol after work. And I believe that the best medication of choice for right now for you is going to be Valium. Now, I say this not to prescribe it long term, but we're going to perform a taper with the medication. And what this taper is going to do, it's going to overall help you with decreased symptoms related to withdrawal, so that nausea, that tremor, and the anxiety that you experience. This medication is going to help you overcome that hurdle in your journey to sobriety. So Valium, it's also known as diazepam, and it's the benzodiazepine. It's a very good medication. It is a controlled substance. What it does is it inhibits the GABA neurotransmitter in your brain. So your brain has all these neurotransmitters, and GABA is one of them. And it works on that by inhibiting the effects. So it basically means that your brain is able to remain calm after you stop taking alcohol. Because after you've been taking alcohol for so many years, which you've had, your body becomes dependent on it. And it can be very difficult to stop because your body craves it. And when you don't have it, you experience those symptoms. And only way to relieve those symptoms is to take more or drink more alcohol, which you seem to have experienced this of recent. So Valium, it also inhibits the activity of the amygdala, which is one of the main spots where anxiety develops. It helps to inhibit those effects to help ease and provide a therapeutic response for anxiety. It also helps to reduce the seizure threshold. I'm glad that you have not experienced any seizures, but alcohol withdrawal, you could see seizures with that, and this will help prevent those and decrease your threshold for that. Now, there are a wide variety of side effects associated with Valium, such as sedation, fatigue, dizziness, ataxia, depression, weakness, slurred speech, confusion, hyperexcitability, forgetfulness, restlessness, and rarely you can experience hallucinations, which are like voices in your head or seeing things that aren't actually there. You could also go into mania. Mania, it's where you stay up late, have these mood swings from depressed to happy. You could be cleaning your yard at 3 a.m. or just abnormal behaviors like spending too much money. But that's a different subject for a different day. Right now, our focus is your alcohol use. You could experience hypotension or hypersalivation. Those are the main symptoms you can experience while taking Valium. There are also some potential risks, such as respiratory depression, which is why it's imperative that you do not take Valium with other substances such as alcohol or specific sedatives or sleeping medications, or just stick with the Valium only until its therapeutic response is achieved. Do not delve into other substances because you do run the risk of respiratory depression, which could lead to death. There are some contraindications with Valium, and that is specifically patients who have pulmonary impairment. Unfortunately for you, alcohol is one of the most common anxiolytic or anti-anxiety medications on the street. It is a drug, and you can see a liquor store around every corner, which makes it very difficult to stop drinking because it's so readily and easily obtainable. Thankfully, though, this medication I do believe will help you with your beginning of sobriety. Let's see. I am going to diagnose you with alcohol use disorder according to the DSM-5 because you have experienced some hardships with work due to alcohol. You did receive a DUI, so your social life is being impaired slightly by the alcohol. You have been drinking for 5 years, which is a pretty substantial and significant period. And the last time you attempted to quit, you went into withdrawal, and which is understandable. You've been drinking for 5 years. There are also many other methods for long-term relief of cravings for alcohol. There's naltrexone, and you could do cognitive behavioral therapy, or you could go to rehab. But for right now, Valium is simply just for the initial stages of cessation in drinking alcohol. And I'm using the Stahl's prescriber guide to get all my information regarding the Valium, which is a very professional source to obtain information from. I've also provided a brochure for you, which has very good information regarding the Valium and the best ways that you can approach cessation of drinking alcohol. Let's see what else we have here. We could say that long-term use of alcohol is harmful. It truly is, and I understand how difficult it can be to stop drinking. I've seen thousands of patients come through, and some of them have had relief with this medication and were able to quit, but some of them relapsed. But if you relapse, then it's okay. We could try again. You've already attempted once, and that's a great start, is recognizing that you're having difficulty with alcohol and you've come to the right place.